So this is a video I didn't think I'd be making. I'm gonna try to keep this brief, assuming I'm looking at the camera at all, because my voice is kind of jacked and my throat's still very raw. So the surgery I went in for last Wednesday didn't happen. The endoscopy happened, but the procedure that I gave my informed consent for did not. All of the appointments before this, we were talking about doing the POEM procedure, the risks associated with it. It was just the per-oral esophageal myotomy. Yeah, POEM. We talked about the risks, we talked about potential side effects, outcomes, whatever. That was the only thing we talked about with the surgeon and his team. So they get in there, they do a test that wasn't discussed with me, the endoflip. That wasn't mentioned at all. And they see a Schottky ring, which I guess is a stricture in the esophagus. It can form for any number of reasons. Usually it's acid reflux, but it can happen from autoimmune conditions, cancer, any number of things. As in the after visit notes, the surgeon had suspicion that this Schottky's ring was driving my difficulty swallowing, and so decided to do a dilation where they basically inflate a balloon in the esophagus to rip it, because it's a growth of tissue, or I don't even care at this point, that grows in, and so they rip it so it opens, and my throat was dilated. So yeah, this test and procedure were done without my informed consent, and I'm feeling all kinds of ways about that. It's like the logical progression of the not listening to me or my symptoms, not talking to me, not taking into consideration my wants or needs. Of course it would happen while I'm out and unable to give consent, or of course he would just assume this is what's causing the problem instead of talking to me and maybe figuring out or taking a second to realize that, like, my dysphagia, like, the recognized start of it was 2017 when I had trouble swallowing. 2017. As far as I can tell, this stricture, this whatever, wasn't seen up until Wednesday. Like, in November when I had the Botox shot, it wasn't noted. Like, everything was fine. They were able to put the endoscope in normally. There were no blocks. It's new. How is this new structure causing a problem that's been going on for years? Why am I making this video? I wanted to update you guys because I've been getting well wishes to recover from the surgery quickly, and I just wanted you all to know that, there was no surgery. There was no surgery, and I wasn't consulted on it, even though it's my body. And it wasn't an emergency situation, because I've looked into, like, consent, and as far as I can tell, like, I don't know, the form I signed, I could see it going either way, that, like, I signed off on, like, whatever the fuck they want to do to me. At the same time, there's stuff where, like, I didn't agree to this procedure, and so he did me wrong. So yeah, I think this kicked off a little bit of a depression, understandably, I think, given the history of everything. So after I came out of the anesthetic and they brought my husband back, the surgeon stopped by to say that, like, he found this thing, so he did this other thing, but if you don't notice an improvement in your symptoms, like, call us back and we can talk about doing the POEM. My husband takes that to mean that, he found this thing, he wanted to try this thing to see if it would help, even though, it doesn't fully fit everything. And he will do the POEM, as he said, but honestly, like, my trust is shot with this doctor at this point, because, like, he already changed his mind once. Who's to say he won't do it again? And looking at the after visit notes, it's less clear that he'll honor that, because recommendation, follow clinical course if persistent or recurrent symptoms, would consider repeat esophageal whatever with dilation versus POEM depending on time course and workup. So to me, that sounds like he wants to just keep doing these dilations instead of addressing what feels to me and seems to me to be like a bigger issue than just the stricture. Like, it seems to me that the stricture grew or formed after the Botox shot, and it's like a secondary thing. And the really shitty thing is, like, once you've had a stricture, it seems like you're more likely to have a recurrence of a stricture. And I don't know, because it can happen with scleroderma, which, if you recall, that's one of the autoimmune markers I am positive for. So it can happen from that just on its own. It can happen from acid. And the thing there is, after the Botox shot, I did get acid reflux. And looking into it further, it's recommended for like aggressive proton pump inhibitors. So like, oh God, what's it called? Omeprazole. Aggressive omeprazole. Afterwards for like at least a couple months, maybe a year, to make sure this sort of thing doesn't happen. But my GI doctor, who's separate from the surgeon, had me stop after 2 months. And I did, because fuck me, haven't learned, don't listen. So maybe the stricture's from the acid reflux, maybe it's an autoimmune thing, maybe it's cancer. I don't know, they didn't do a biopsy. So yeah, the husband thinks that, you know, because my symptoms have not improved and they haven't, like, food's still sitting on top of there, it hasn't fixed the problems. Okay, we tried the thing, we'll do the poem now, but I'm not so sure. I honestly think I'm gonna have to, I don't even know, that I had the treatment that I wanted, and it's just, it's gonna be just moving the goalposts, and so I'm just gonna have to deal with this fucking dysphagia, and there's nothing I can do. I'm so tired of crying. I'm so tired of crying. I have a follow-up appointment, not next week, but the week after, which I had to twist their arm into giving me as soon as possible to discuss what comes next. And I don't know if they'll be able to squeeze me in soon for a poem, or if it's gonna be like 6 months. I don't know. It's so sad because I had to prep food for the recovery because I was supposed to be on a clear liquid diet for a couple days, and so I made Jell-O, and it's fucking triggering me because it's just a reminder that it didn't happen. And a really fucked up thing. So I'm crying because of the situation, right? And so I get mucus that just goes down the back of my throat, and it gets caught on like whatever this stricture thing is. And so I'm like having to kind of cough to dislodge it, but not cough too hard because then it like hurts, and it's fucking hell. So I guess I'm gonna work on the next video. It should be beyond order. We'll see if my throat is intact enough to record for however long these things take to record next Monday. We'll see. I don't know. I don't know what's coming next. It kind of hinges on how that follow-up appointment goes, which unfortunately for like how my video production tends to go is not a good day. Yeah, I don't know, you guys. So if you follow me on Twitter, and assuming I'm not shadow banned, you saw my thing about this, or also talked about it on my Discord. On the Twitter thread, you probably would have seen the responses saying this is malpractice, and I don't know. A friend tried to pursue a malpractice case for something for their dad, I think, and we're told that it's a very, very difficult bar to clear. So I don't know. I don't know. My plan right now is, whenever the outcome of this becomes clear, initiate a complaint against the doctor because my consent was not obtained, and that's not right. If it escalates further than that, I don't know. But yeah, so that's where I'm at. A little bit of a depression with a not entirely functional voice. So I'm gonna work on the video or work on the script next week, and I'm not sure if I'll be able to film next week, if my throat will be up for it and the timing with the follow-up appointment. But I'll be working on it and get it up when I can. as always, like, thank you so much for the support. It's helpful to know I'm not crazy in the situation, that I'm allowed to feel violated, that what the surgeon did wasn't right, and I know it helps. I mean, it doesn't make the situation right, but at least I know I'm not alone. So yeah, that's this weird impromptu video recorded on my phone. Yeah, so hopefully I'll be back with better news next time.